Common breast problems include breast lumpiness, single breast lump or mass, breast pain, breast tenderness, nipple discharge, nipple inversion, meaning the nipples point inward instead of outward, and that is new and has occurred in just one breast. Changes in the skin of the breast, like redness or puckering. These problems can happen at any age. See a doctor if you develop any of these problems. Breast problems are not usually an emergency, but you should get checked out as soon as possible. Nipple discharge. Having a milky-colored discharge, or galactorrhea, from both nipples is common, especially during the first year or two after giving birth. Nipple discharge from both breasts can also occur in women with an underactive thyroid, as a side effect of certain medications, or because of a growth in the pituitary part of the brain, causing an increase in prolactin hormone. Many women can squeeze out a small amount of yellowish, greenish, or brownish discharge, called physiologic discharge, and is not a cause for concern. Physiologic discharge is not bloody. Spontaneous nipple discharge, or discharge that occurs without squeezing, or nipple discharge that is clear or bloody, may be caused by an abnormal growth within the breast or, less commonly, by breast cancer. Any woman with nipple discharge should be evaluated by a doctor. A mammogram, breast ultrasound, breast MRI scan, and/or examination of the breast ducts or ductogram, also called galactogram, may be recommended. Inverted nipples. Many women are born with nipples that naturally invert or pull in at times and evert or poke out at other times. Other women find that this happens after breastfeeding. Nipple inversion of this type is not cause for concern. If your nipples have always been everted, however, and begin to invert for no obvious reason, this should be evaluated. Most causes of nipple inversion are not a cause for concern, but occasionally this is the first sign of a breast cancer. Abnormal mammogram. Most women with abnormal mammograms do not have breast cancer. It may be due to a mass, a collection of calcium deposits called calcifications, or other factors. If you have an abnormal screening mammogram, the next step depends on the type of abnormality found. If the abnormality is likely benign, you may be advised to have a follow-up mammogram in 6 months. If the mammogram shows an area that is quite abnormal, the next step is to have additional imaging, or diagnostic mammogram. During a diagnostic mammogram, different angles can be used, and the picture can be magnified and/or targeted to a particular area. Often ultrasound may be done to better define the abnormality. Usually, the diagnostic mammogram shows that the abnormality is benign, and no further testing is needed. But, if the diagnostic mammogram is indeterminate or suspicious for cancer, a breast biopsy is recommended. Sometimes MRI may be required to further evaluate the abnormality found on mammogram. Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.